What is about diarrhea syndrome? My name is Josberlin Vega and my group is Manuel Juga, Andrés Castro, Julia Tuve, Nicole González, Olismar Silva, Eudelis Morales, Ariane Ortega, and Agabian Mora. What you need to know: the term diarrhea comes from the Greek diarreico, meaning the flow route. Diarrhea is a digesting disorder or symptom, not disease, characteristic and grease, in the frequency of bowel movement with a fluid consistency, ranging from liquid to semi-liquid, thus affecting the normal functioning of the intestine. Symptoms: nausea and vomiting. This is symptom occur due to irritation of the gastrointestinal tract, dehydration, gastro-reflex, stress, or a protective reflex of the body to expel and food substance. This is cause can lead to stomach discomfort during diarrhea episodes. Abdominal pain. This is due to intestine contraction, inflammation, gas accumulation,
fevers. These occurs are responses to intestinal infection, active food activates immune system to combat pathogens. Dehydration. This condition is combating by intestine juice to mold the skins that urine at the cracks, the sickness, fatigue, confusion, electrolytes, throat bleeds, stool or vomiting. Stratorrhea is present excessive spread of teeth to stools, making sign of that malaxations can active various digestive constitute as bracketing, insufficient celiac or tropical stool.
Classification of diarrheal syndrome. Acute diarrhea lasts less than 2 weeks is usually caused by infections, food poison, of dietary channels. Chronic diarrhea can be caused in underlying conditions such as diet, food intolerance, or persistent infections. Because or mechanics: infectious diarrhea is caused by various infectious agents, most commonly bacteria is Salmonella, E. coli, virus such as norovirus, rotavirus, and parasites with Giardia. These infections are usually transmitted through contaminated food or water or direct contact with infectious individuals. Visual characteristics: water diarrhea, liquid uniform stool, common in viral infections. Diarrhea with mucus or blood may indicate a more severe infection or inflammatory bowel disease. Fatty diarrhea or stratorrhea, bulky smelling and greasy stools, which may indicate fat malabsorption problems. A special case with travel diarrhea, common in people travel to areas where food hygiene is poor, generally caused by bacteria or parasites.
Anamnesis. It's important to evaluate recent stories such as travel, consumption of suspect, false contact with people, or presence of antibiotics. Medical story. Specific symptoms will be evaluated, such as the frequency and the consistency of stools, the presence of stools or mucus, abdominal pain, nausea, vomiting, and fever. It will be determined whether the diarrhea is acute, less than 2 weeks, or chronic, more than 4 weeks. Medical story. Information of previous illness, gastrointestinal condition, recent medication of special antibiotics, and chronic disease. Travel story. As above, recent travel, as some infections are more common in certain regions.
Physical examination evaluates sick of dehydration, dry mouth membranes, decreased skin turgor, elevated heart rate. Examines the abdomen for tenders, abdominal pain, or distension. Laboratory tests. Depending on the clinic history and physical examination, several tests might be required. Stool analysis to detect pathogens, bacteria, virus, parasites, occult blood or fat in malabsorption is suspected. Complete blood count (CBC) to evaluate signs of infection of the heart, tenders, abdominal pain, or distension. Laboratory tests. Depending on the clinic history and physical examination, several tests might be required. Stool analysis to detect pathogens, bacteria, virus, parasites, occult blood or fat in malabsorption is suspected. Complete blood count (CBC) to evaluate signs of infection of dehydration. Serum electrolytes to evaluate electrolyte balance and hydration status. Stool culture if a suspected bacterial infection is suspected. Digestive endoscopy to evaluate to small intestine or colon is inflammatory bowel disease are suspected.
Medication rehydration or rehydration solutions are fundamental for preventing or treating rehydration, especially in case of acute diarrhea. These solutions contain water, salts, and sugars in specific proportions to help replace lost fluids and electrolytes. Intravenous fluids is in several cases the solution is not be necessary to administer fluids intravenously in hospital setting. I would say certain foods is advisable to avoid fighting specific dairy products, especially interest intolerance, allergy, or alcoholic beverages with diarrhea results.
Loperamide. This medicament slows intestinal movement, will help the body absorb more water and the electrolytes, which in turn hardens the stool. Racicadotril. This medication reduces the secretion of water and the electrolytes in the intestine, which help decrease the frequency of bowel movements. Sulfates. Although this medication is usually prescribed to the relieve pain, it is also used to treat diarrhea, especially in more antibiotics. If diarrhea is determined to be caused by a specific bacterial infection, antibiotics may be prescribed. Their indiscriminate use is not recommended as they can worsen certain types of infection. Doxycycline is the first-line antibiotic recommended for adults except in pregnant women, according to MSD manuals. Antiparasitics. In case of the diarrhea caused by parasites, specific medications will be used to eliminate the causes parasite. Each diarrhea is a symptom of the underlying disease.
Diarrhea complication 1. Dehydration. Excessive loss of fluids and electrolytes through a stool can lead to dehydration, which is one of the most serious complications. Diarrhea. This can lead to kidney and cardiovascular problems. 2. Electrolyte balance. Diarrhea can cause the loss of essential electrolytes as sodium, potassium, and chloride, which can affect the normal function of the
heart, and muscular. This is the complication associated with antibiotic use that can result in a chronic disease infection causing severe inflammation of the colon and profound diarrhea. For kidney complications, severe dehydration can affect kidney function, leading to kidney failure in extreme case. 5. Unpreliminary shock. In case of very severe unpreliminary diarrhea, massive fluid loss can lead to a critical condition known as unpreliminary shock, which is a medical emergency.
Recommendation: hydration is essential to stay hydrated. Drink plenty of water and consider oral rehydration solution as a significant amount of fluid y electrolytes can be lost leading to hydration. Appropriate diet for easily digestive of food like boiled wheat rice, bananas, apple sauce, sweet potato, fresh eggs, vegetal and chicken broths.